Hello, everyone, and welcome to our annual Fight the Fakes week. Today we have our flagship seminar. Thank you for joining and for all of your support. It's critical in fighting the fakes. My name is Oksana Pyzik, and I am a lecturer at the UCL School of Pharmacy, as well as a pharmacist and the academic lead of UCL Fight the Fakes. And I'm going to be moderating this panel discussion today. We are very privileged to be joined by people who are leading in this front. For a little bit of background context, Fight the Fakes Week is an annual week-long event raising awareness on the substandard and falsified medicines. And this year, our theme is on Africa to speak up and stand up against substandard and falsified medicines. Our keynote speaker today, we are very excited to welcome Michel Sidibe, who is the African Union Special Envoy for the African Medicines Agency. So over to Michel. Thank you very much for joining us today. And also just a note to everyone that if you would like to follow the event in French, please click on interpretation next to the globe symbol in the bottom bar. And please also, anyone who's joining, don't forget to click mute. So over to Michel. Thank you again for joining us from your beautiful backdrop. It looks gorgeous there.
Thank you very much, Oksana, for this very nice introduction. But I want to just to start by saying it is an honor and privilege for me to join you today. I can see my brothers and friends, and I will not say ladies and gentlemen who are outside and listening. But today I speak to you through this video to address a crisis that is not just impacting our continent, but indeed, I will say even ravaging our population and our different countries. I am talking about the widespread prevalence of counterfeit and substandard medicines in Africa. This issue transcends mere health statistics. It represents a profound breach of trust in our healthcare systems. It has a devastating effect on the well-being of our communities, particularly the poorest segment of our society, and poses a significant obstacle in our journey towards achieving comprehensive health care. I want just to stop and ask you to consider the situation in Nigeria. I am seeing my brother there, where a mother, without knowing, administers counterfeit anti-malarial drugs to her sick child. Or in Ghana, where families experience the tragedy of treatment failure after using fake antibiotics. These heartbreaking scenarios are replicated, unfortunately, across Africa, highlighted by the devastating, I can say, incident in Gambia, where over 60 children lost their lives due to contaminated cough syrups. The World Health Assembly, as you know, estimates up to 30%. I can say in some of our countries is reaching 50% of the medicine sold in some part of Africa or counterfeit or substandard, a statistic that underlines a grim reality. These criminal acts perpetuated by, I can say, unscrupulous individuals and groups contribute to approximately 500,000 annual deaths in sub-Saharan Africa from fake anti-malarial drugs and antibiotics. Also, we have to recognize that institutional corruption plays a pivotal role in the proliferation of fake medicines. This corruption can occur at various levels, from the manufacturing process to distribution networks, and even between regulatory bodies meant to safeguard the drug quality. Corruption can facilitate the entry of counterfeit drugs into the market, impede regulatory enforcement, and undermine efforts to track and recall these medicines. It is not just people who are suffering, but economically, the illicit counterfeit drugs market valued at up to $200 billion, not only strengthens health system, but also local economies. Between 2013 and 2017, a staggering 42% of the substandard and falsified medicine reported to WHO originated from our region. I'm talking about Africa. Moreover, the prevalence of counterfeit medicines poses a dire threat to the development of local pharmaceutical industries. It undermines consumer trust, even in high-quality local products, and distorts market competition, making it difficult for legitimate local manufacturers to thrive. It diverts critical resources from nurturing local pharmaceutical production and discourages investment in market perceived as high risk. These challenges are compounded by the additional regulatory burdens placed on local producers. Yet, amidst this dire situation, there are success stories of resilience and effective response. Guinea-Conakry's aggressive measures against counterfeit medicine traffickers led to significant drug seizures and increased public vigilance, showcasing the impact of strong legal and enforcement actions. Similarly, Rwanda's effort in fortifying its pharmaceutical sector demonstrate proactive steps in curtailing this illegal and harmful trade. The African Medicine Agency, AMA, stands central in the fight against this criminal activity. Since the AMA Treaty came into effect in November 2001, considerable progress has been made towards a unified regulatory framework for medicine across Africa. The rapid ratification by 32 member states with 26 formal ratification underscores a continent-wide commitment to enhancing healthcare standards and combating these criminal acts. With the recent establishment of AMA's operational base in Rwanda, we move closer to realizing our goal. However, the journey continues with the imminent appointment of AMA governing board members and the selection of a director general. I urge all African Union member states, especially influential countries like Nigeria, South Africa, DRC, and Cote d'Ivoire, just to name those, to ratify the treaty, enhancing AMA's capacity to combat these criminal activities effectively. Their involvement is crucial for advancing medicine regulation and healthcare standards across Africa. Our unified efforts under the guidance of the AMA, African Medicine Agency, are essential. drawing inspiration from successful initiatives like those in South Africa, where community reporting has made significant inroads in the fight against counterfeit drugs, we are committed to implementing stricter laws, developing a robust drug monitoring system, and utilizing technology. In conclusion, our battle against counterfeit medicine is a fight for health, dignity, and economic prosperity in Africa. It is a fight against criminal acts and institutional corruption that threaten our populations. By protecting our vulnerables and putting communities at the center of our action with the patient groups and ensuring access to safe, effective, and quality healthcare supported by robust local pharmaceutical industry under AMA's guidance, we are committed to eradicating the scourge of counterfeit medicines from our continent. I thank you, Oksana.
Thank you very much, Michel, for giving that overview, and particularly around the significant achievement of the AMA ratification in November 2021. I wonder if you might tell us a little bit more about how the advent of the African Medicines Agency has changed the ability to prevent fake medicines from reaching patients in Africa, and why this region seems to have the largest burden of substandard and falsified medical products.
I think your question is very pertinent one. I will start probably by the first one. If we have a strong regulatory body, it will just make our health ecosystem working better. You will never have a strong health ecosystem without a strong regulatory body. Like I was mentioning, you will see that this all fake medicines and others, without harmonization, without a cross-border approach, we will not be able to do it. We saw in many cases that the problem is not just a problem of one country and another, is a lack of a strong processes, and a strong institutional, like I said, engagement, reducing corruption. Let us not be scared by saying that also. Fighting is a criminal, twofold is a criminal because it is a mafious group who are taking advantage, but we are killing poor people, like I was just mentioning. But I know that my young brother Oscar will talk more about that, so I don't want to spend too much time on that one. He's more competent than me. But the point I want to also underline is your good question. Why? It's a very simple one. I will say one, regulatory challenges, limited regulatory capacity and enforcement. Two, demand for affordable medicines. High demand for affordable medicine leads to a market for cheaper substandard or falsified. We are today, 17% of the world population in Africa. But we have to know that at the same time, we are representing 25% of disease burden. So the demand for affordable medicine is key. And we can see that out of pocket, expenditure is representing almost 40%. Prevalence of infectious disease, I don't want to explain, but the complex supply chains I was mentioning, the multiple intermediaries in the supply chain increase the risk of counterfeit infiltration. I talked already about porous borders, weak border control, and the lack of inter-country regulatory harmonization and coordination. All those are key and limited, of course, of public awareness. All of that, if you put them together, Oksana, is giving you a cocktail which is creating space for all those exploitative business in our continent. But I am sure that if we manage to really commit ourselves, bringing patient groups together, bringing communities, and making sure that we establish a strong African medicine agency, we will be able to progress, certainly fighting those substandards. And also, Oscar will talk about it, if we can also join forces. I stop there, Oksana, because I know your panel is, you have competent people who will certainly add more than what I was just mentioning.
Thank you. No, it was very interesting response, and I think we will hear more about why this is sometimes described as the perfect crime, but just also flagging to all individuals that you can get the speaker info profile in the chat, so have a look at that. Next up, we have Oscar Alarcón Jiménez, who is the Executive Secretary Committee of Parties to the MEDICRIME Convention Action Against Crime Department. So Oscar, if you could please share with us your thoughts on this is the very serious crime.
Good afternoon, everybody. Thank you very much, Oksana, for giving me the floor. And I would like to welcome all the participants here, all my colleagues, brothers. I see Mr. Sidibe. I see other familiar faces along here with me, Cecilia Fant and others. So it's an honor for me to take part on this. And I will take over what Mr. Sidibe just mentioned. I mean, the falsification of medical products, we can say that it has a big impact, in particular to human rights on the first hand and to public health on the second hand. Why to human rights? Well, first of all, because it's evident. It violates the right to life and also the right to health. But then in relation with public health, this falsification of medical products, it jeopardizes public health and also the most important thing, patients' confidence. So in fact, this falsification of medical products is a problem of global proportions, and it has, of course, a transborder, a transnational dimension. We can then sum up saying that this falsification or counterfeit of medical products, it's a problem of global proportion. It violates basic human rights. It's a direct threat to public health, and then of course it's a transborder crime. So then we can ask ourselves why a supranational action is needed, why international action is needed. Well, first of all, because this is not an issue, the falsification of medical products or medicines. This is not an issue only for one country. All countries are concerned about it. It is important, first of all, to establish that, harmonized definitions are needed. We need to know what pharmaceutical crime means, what counterfeit means, what falsification means, what labeled means, falsely labeled means. It is important for whom? For those who need to apply the law, legal actors, legal professionals, for those who need to also apply the law enforcement. Sometimes we forget that we have outside there, we have police people, we have also customs services that need to apply the law. So they need to know exactly what are we talking about. Secondly, sanctions. If we want to deter this activity, which is extremely widespread, we need to establish sanctions to prevent these actions to continue being committed. And one of the important elements is international cooperation. Nothing will happen if we continue working alone. Every country by its own. We need all to cooperate together. And this is one of the reasons why the Council of Europe, along with other international organizations like UNODC, as well as the European Union and the WHO, gathered together to draft a legal instrument, a legally binding instrument. This is not the only, the solution. It's one of the tools that can be used to solve this problem. But this solution is called MEDICRIME Convention, which is the first and only international legal instrument countering the falsification of medical products. It's a criminal law convention, and it aims to prevent and combat threats to public health. How? In a very easy way, with 3 actions. First of all, prosecuting. Prosecuting what? The counterfeiting of medical products, the falsification of medical products. If we don't prosecute, it will continue. And that is one of the problems that nowadays we have in a lot of countries. This type of crimes is not prosecuted. Secondly, we need to protect the rights of those that have been victims of this crime. And secondly, we need to promote national and international cooperation. I will stop here because I see that there are other speakers here. So if you have any question, please shoot it.
Thank you, Oscar. And I just echo as well that if there are questions, please do feel free to put them into the chat. And also looking at what we as Fight the Fakes are doing in terms of the mission to raise awareness, but also with this particular call to action, which will also be sent in the group chat. So please have a look at our call to action that is coming through into the chat right now, and to see that what we're trying to really get this message across, that given how we have had a string of diethylene glycol poisoning, industrial solvents used in brake fluid, antifreeze, etc., ending up in pediatric syrups, meaning that not only does this undermine the trust in healthcare workers, healthcare systems, and healthcare products, pharmaceutical products, that echoing the words of the WHO Director General on there is no universal health coverage without quality assured medicines. And we strongly endorse this message, and we ask you to also sign our call to action in the chat. So starting with prevention to ensure that quality medicines are at the center of UHC, and that we implement comprehensive policies to, first of all, prevent these products entering into the supply chains or through other methods, adhering to those standards for medical product quality, and also echoing what our other speakers have already called for, the global regulatory capabilities, making sure that we're building them, supporting them, strengthening regulatory systems, and enhancing global cooperation. This requires economic incentives for production of innovation and quality products. But detection is equally important. And this is also something that we see is lacking globally. So we need to support the development and implementation of a robust national surveillance and traceability systems that work with appropriate regulations in a streamlined solution to make it easy for people. And finally, response. And this we will pick up in our panel discussion even more, because with very high reward, we heard from Michel that it's a $200 billion industry, very low penalties. We've heard from Oscar about the need to be able to prosecute. This is why it becomes such a lucrative crime. So response, at the heart of it, we need to increase collaboration with law enforcement and custom authorities. So please, again, because we do not want to have any more children die unnecessarily from syrups, that if we value health, we need to protect medical products so they heal instead of harm. So that is our call to action. And we will now begin our panel discussion. So I'm really honored to be able to invite Adesanya Oluwaseun Adedotun, who is the Assistant Director of the Drug Division in the Post-Market Surveillance DGO of the NAFDAC, the Nigerian Association, and is also the World Health Organization focal point for substandard and falsified medical products. And he has recently become our first Goodwill ambassador of the Fight the Fakes Alliance. So we're very privileged to welcome Adesanya to our panel. as well as Professor Cyril Odianose from the University of Benin in Nigeria. And Professor Usifoh and I have previously worked on the FIP, International Pharmaceutical Federation, and WHO pharmacy curricula project. So we'll be definitely asking him more about that. And we also have Cecilia Fant, who is the former director of the Pharmaceutical Security Institute and a pharma crime consultant who has a wealth of experience and knowledge, who will be able to answer some of our very tough questions on this topic today. But I will first go to Adesanya to say that with your experience in terms of the strengthening of the regulatory side of things in Nigeria, what is the role of the national and regional authorities in this space? And can you provide any examples based on your experiences of NAFDAC acting on this, any success that you can share with us to talk about this issue?
Thank you, moderator. Good afternoon, good morning, good evening to all participants on this call. I welcome you to this Fight the Fake Week celebration on SF. I want to also thank the organizers for the privilege to be part of the presenters this day. I want to start also by recognizing what one of our fathers in Nigeria that started the fight against substandard and falsified medical products is also on this call. I could see Alhaji Hashim Ubale on call. Is also a known figure when it comes to fighting substandard and falsified medicines in Nigeria. So you have a very strong attendees for this call. So to your question, as you've asked, as regulators that we are in NAFDAC, strengthening the capacity of the authority to respond to incidents of substandard and falsified medical products, particularly as it has to do with Nigeria, we play a very significant role. And I will limit myself to the scope that you have given to me in terms of prevention. And for us as regulator, the first pillar that leads to prevention of SF within the system, the supply chain system of medical products, is awareness. If the people or the public is aware of what a substandard product is, what a falsified product is, then they will not fall victim. So one of the things that we do as regulator is to increase our level of awareness in terms of the knowledge of SF, the identification of SF, and information sharing amongst the relevant stakeholders that handles issue of SF, particularly putting the reportage of identification or detection of SF in the hands of the patients. And for us in Nigeria, we've done quite a number of innovations around this. Of course, we register our products, we list some of our products, then also we also authorize some products that are to be in our market. So any product that is not registered with NAFDAC, that means we'll let the public know that you need to check for NAFDAC registration number on any particular product that you want to use. So if you don't see any product with a NAFDAC number, you tend to suspect that product as either being substandard or a falsified product. Yes, we might have some unregistered product or unlicensed product in circulation through the listed permit. So we tend to create awareness in this regard. Secondly, we build collaborative networks amongst the relevant stakeholders that handles. I hope I'm not speaking too fast.
No, perfect.
Oh, good. So the network, you are good. The network that we build is such a robust one, such that as I speak with you, we are reviewing the country's national plan on handling issues of SF, and we are engaging the relevant stakeholders. This time next week, we will be having an engagement with these stakeholders, and we've invited over 37 regulators. So it means the collaborative effort is really out there. These are regulators. We are also going to engage the supply chain stakeholders, the pharmacists, the nurses, the doctors, the practitioners, the healthcare practitioners that are there. So we have this collaborative effort amongst ourselves. One key thing I mentioned about awareness is to publicly let the public knows that if you are procuring your medicines, procure them from a recognized prey into buying from illegal or informal sources. Then, of course, one good thing that we also do as regulator to prevent the infiltration of substandard and falsified products is that we tend to build the integrity of the supply or the distribution chain. And how do we do this? Nigeria is the country wherein most of our medications are imported. We have a higher percentage of our products coming in compared to what we produce in country. So we have most of this product that comes in from the Southeast Asia. And we tend to now put in a policy in there that without a clean report of inspection analysis certificate from the country of origin, particularly from India and China, such products will not come into our country. So we have some of course, some people evading this certification. And of course, we're also going after them. This tends to prevent any SF from coming into our circulation. And from our own side too, we conduct routine surveillance on our facilities. We do random sampling, wherein we test the quality of the products in the market, particularly for us to detect substandard in the market. Because we expect that products that will be sold at these facilities should be products that are of good quality. And without you conducting this the survey to analyze these products, you will not be able to speak on their quality. And by so doing, we've been able to detect some substandard, which has to do again with handling of these products. So we also do enough sensitization of the facilities that handles these products. Most importantly, on temperature sensitive products. In the last 3 years, we've done a risk-based sampling of maternal health products, specifically on oxytocin. The first one we did in 2017 gave us a very high percentage of substandard products. We did again in 2021. We had a tremendous improvements on the qualities of this maternal product in the market. And as I speak to you also, we are about we've sampled again this maternal health products, and we are taking them for analysis, also to speak on the quality of this product. So many surveillance activities are going on. Of course, so many things we do. We have our eyes at the port before the product comes in. And again, you can't do this we can't prevent SF without gathering enough intelligence. So we also tend to gather intelligence to detect illegal manufacturers and also illegal distributors. So I think
Adesanya, that's a great place to stop, because it's such a complex issue, and you've highlighted so many key points. We could I think give you the whole day on just that subject alone, but we do also need to hear from Professor Usifoh about the role of education in prevention of substandard and falsified medicines.
Excellent. Let me stop at this point then.
Okay, thank you. So over to you, Professor Cyril Usifoh, about the role of education in prevention.
Thank you, Sana. I hope my network will be okay. Promoting effective education and awareness to relevant stakeholders is critical. But let me quickly mention that you can manufacture SF product in a country, and then it will be meant for use in another country. And so SF may not necessarily be manufactured in a country, but maybe used in another country in terms of movement of some of these commodities. So you can imagine that a country may do its work properly, but they get constant flow of standard and fake drugs. But principally, we need to fight the fakes. And one of the things I believe we do is to involve pharmacists, students, employers, and all the rest in a roundtable discussion on how to formulate curriculum to better educate students. It's not enough to have a fixed curriculum, so to say, and allow the students to just digest it. But you also want to get information for stakeholders about employers and the rest of them. Principally, what we do at University of Benin, apart from the practical way, we first of all let the students see how they can identify fake and adulterated products visually, even when you don't have pieces of equipment to run analysis. Then if you suspect this, then you can actually go further to carry out some analysis. I will just give you a good instance. One of my students after graduation suspected a liquid. I felt it wasn't paracetamol, it wasn't ethanol used in paracetamol syrup. And I questioned him. He said, well, I take alcohol. I know the smell of alcohol. I said, fine. And while we came down to do the analysis, I just said, we don't need to use the HPLC. The boiling point of methanol is 64. Y dot of ethanol is about 78. So that's a simple thing. Within 5 minutes, we knew the product we had, and we found that it was methanol. It was devastating for me as a professor that somebody in his right senses, like what my colleague said, will use methanol to formulate paracetamol syrup for infants and children. It was heartbreaking. Now, when we educate our students, they will know what it takes. Then we need to get the regulators involved. We need to let the student visit the regulator. We need to let the regulators also come in to teach our students. Then we need to provide the enabling environment for these students to learn more about fake and substandard drugs in terms of lecture delivery, in terms of equipment to carry out analysis, and equip the teachers and lecturers so that they can carry that work effectively. And I feel lastly, we will need to carry out some advocacy. In fact, I may just say here, without prejudice, I will have a meeting on Monday with the Honorable Minister of Health. And one of the things I'm going to escalate there is what we are discussing today, so that we'll bring that Africa will stand up and speak against fake and adulterated drugs. I can assure you I will take that, I will escalate that as president of Pharmaceutical Society of Nigeria. And finally, it may look low, but somebody spoke about that. We need to address poverty. When people are poor, where they cannot afford drugs, they will go for cheap, fake, and substandard drugs. And we need to start this right in school so that our people become ambassadors when they leave school and not become participants in enriching themselves. Thank you very much.
Thank you very much, Professor. I think, we're very grateful for your input on this, particularly with your leadership on the pharmacy development curricula, but also, as you say, in terms of not just education of pharmacy students, but also to be an ambassador to the wider public and raise awareness. That I think is an absolutely essential aspect of fighting fake meds. Next up, we have talking about sort of the detection aspect is Richard Neci, who is the Executive Director of Ecumenical Pharmaceutical Network. So in regards with detection, what do you think is the most important aspect that is missing in the supply chain piece? For detection, what more needs to be done here?
Thank you, dear Oksana, and I would like to really appreciate all the discussions going on, and appreciate also to see Mr. Michel Sidibe. It's a pleasure, and I hope we'll continue to connect. And I can see also in the panel, in the participant list, that we have Richard Jank. He's the pioneer of the GPHF mini lab, and he's the one who is still continuing to help developing new reference standards, which can be tested by the mini lab. So I really appreciate to see him in the call.
Richard, could you tell us a little bit about the mini lab? Just maybe that's a good place to start.
Exactly. I think the mini lab it's called GPHF mini lab, which is Global Farm Health Fund. It's a project developed by Merck, and which is really making difference in terms of detecting falsified medicines and substandard medicines. It's we use usually 3 steps of analysis. First is the visual inspection of product, and after that, and this we inspect the package and label. Secondly, we go on simple disintegration testing, and after that we do thin layer chromatography. And as all the discussions are going on, I want to really emphasize that it's really important to raise awareness, but also in our day-to-day work, EPN is a network of Christian health associations and church drug supply organizations. And what we found as the starting point is to make sure healthcare workers who deal with medicines are able also to detect, at least to detect, because most of the products which are falsified in our continent, you can, if healthcare workers are well trained, informed, they can be able to see just looking at the package, and it can be a starting point. It's not enough, but in our network, we have seen wherever they are, these healthcare workers who have been trained, we have very simple training on how to look at the package, how to distinguish to be familiar with all the product they are receiving in the facilities. But also we try to help them how to look, how to be attentive in looking on all what is mentioned on the label. And we have found 2 changes in Z, or you find a date which is mistaken, the word which are not clear. And most of samples sent by healthcare workers to our mini lab, when you test, it's fake, because they really know that this is something which is suspicious. So building the capacity of healthcare workers on how to check the product is important. But also we have developed some checklists. And I think these checklists are very available. I remember the Tropical Medicine Institute has really worked on this, and because health to develop a very simple checklist. And we are using this checklist. It has been also a very good instrument at local level, facility level, to see if the product is responding to all the requirements before accepting it to enter the system. And there is also the guiding on the decision. If it doesn't respond, you can put it aside and send it to the mini lab for testing. Another key point in the detection, what we found is the question of affordability. It has been said, and really I appreciated this, because we have facilities, most of the church facilities are in rural area where already the capacity to pay medicine, the patients are paying out of the pocket. And this push sometimes facilities to look for cheaper products. And this is one of the challenges they are facing. So we also developed a training on the concept of quality, so that this can help healthcare workers, especially those who are in decision-making around procurement, to know how to balance the need for affordability with quality. And it's simple. We train them on the 7 characteristics of quality medicine, and this has been very powerful to raise awareness and to bring them to consider not only the price, but the quality. So this is at the one side, but now the testing, the EPN network, we are able to test every year more than 1,000 samples across countries. And I think Sidibe talked about cross-border surveillance. Our network has been very, very instrumental in this checking, because when we find a substandard product in one of the country for our mini lab, we have a network information sharing, and the first thing to do by other mini lab members is to check in their local market, in their health facility, if the same product batch number is not there. Actually, we have 19 mini lab partners in 13 countries, and all of them try to check quickly. And we have found some products in Cameroon which are we found also in DRC, in Central Africa, because of this. And yeah, so I think this is some of the key actions which are necessary. But also I think in the detection, it's important to have the leadership of regulatory authorities. I want to mention that the mini lab is not a tool which replaced the role of the regulatory authorities. In some countries, even we have found some challenges in collaborating with them because they think we are doing their work, while all our results are shared first with regulatory authorities. We give the details of where we found the product so that they can take action. And maybe we'll come to this later. In some countries, we have found good responses, very timely responses, but in other countries, you find the fake quinine in the system, but you take 3 months before putting the product away from the system with all the danger of those kind of products. So I think collaboration is very important, and this requires not only regulatory authorities, public sector, but including also private sector. And again, when it comes to the good dispensing and rational drug use, it's a community matter. So any civil society can also be involved in the awareness, media, university, and all the partners should really be involved when it comes to the monitoring in the country. So maybe I can stop here and add if there is any other question.
Yes, thank you, Richard. I think, it's really fascinating to hear about the work of the mini lab, but also that it's just one component that requires much wider support in health systems, but also just thinking about the scale of tragedy, that 1 in 10 medicines are either substandard or falsified. And in some areas, we know that number is much, much higher. This is a best estimate. It's an average, and it's what we are able to do. And within research, we know that even just testing for these products, usually it takes mass poisoning, other types of events to detect this, such as the hundreds, if not thousands, of children who died of the DEG poisoning. We know that this has been ongoing every couple of years, these strings of deaths. So this leads me on to our final panelist, Cecilia. I wonder if you can share with us a little bit about what needs to be done at the intersection of private sector as well as law enforcement to ensure that these types of tragedies that we see on cycle, I think the last one has been unprecedented. We've looked at Gambia, Indonesia, Uzbekistan, really globally happening, but in so many other products as well. Over to you about the response aspect about this, particularly on law enforcement.
Yes, hello. I'm very happy to be here, and I'm thrilled to talk about this subject. Africa is very close to my heart, so I'm happy to be here. Well, this is, of course, a very complex question. I mean, we hear all these people that have great information. They worked in this area for a long time. There is no one solution. In general, so I work for the law enforcement, I work for the private sector, and now I'm working for myself. But when you look at law enforcement, I mean, you have customs, you have police, and there are other agencies. I mean, to be honest, they do what they're told to do. So they need to have a strong force from above that say, okay, this is what you're going to focus on. And I can say from my time when I worked for Interpol that law enforcement, they do what they can, but in Africa, there are I would say in the most countries, no. Not NAFDAC, of course, but in many countries, there are not money to that are like only for pharmaceutical crime. There are like priorities because there's not enough money. So there are like cybercrime, there are narcotics, etc. So that's what police have money that are like saved for that area. So usually, if something's going to happen, they need, money to do operation, etc. And then, we're like big organizations like Interpol, the WHO, come in and can help. But when I always think about this, you have to look at the good sources. Every country are doing really hard work on this. But many times, law enforcement doesn't work with the Minister of Health, for example. There are like issues in between. And I don't say it's because of Africa, because in my country, Sweden, we had big issues. It's everywhere. It's hard. If you don't know each other, it's hard to reach out to help. So I would say, if you're any country, well, I mean, all of us have problems when it comes to pharmaceutical crime. We have to actually establish networks in a way that we need to have a task force. That you need to know that when something happens, you know, like with the cough medicine, who are you going to phone? How are you going to talk? How can we stop this quickly? If countries sit down and say, okay, I mean, Minister of Health, you are very good at the medicine, what it's all about. Customs, they can check all the people by the borders, you know, and actually see why is this furniture agent importing, you know, powder. I mean, there are so much things that can be shared from their point of view. Police, they are doing all their arrests and they have a lot of information. This, if they could be sitting down and actually say, okay, what can we do about it? And when these things happen, you know who you're going to call, which agency. If that person has left, there should be, you know, a second one in turn. That would help everyone. And it's not about, it's my case, it's about our country, our people. We want to save the people in our country. That's why we have to work together. And because sometimes, you know, I can say it because I'm from the law enforcement, it's my case, it's my area. People are a little bit afraid to lose face or to lose control. But it's not about that. It's about taking all the good sources. And then we come in here. We are good sources. When there is a problem in a country, people like us that were working a different day, we should be able to help if they see there is a problem. Because often, you know, you can see there are big operations, there are workshops from different agencies, and it's like a little bit of a mishmash. Everybody wants to help, and everybody wants to help people in Africa. We talked about legislation. Yes, it's a disaster. Look, I'm very honest. It's great, you know, the awareness campaign, and of course we have to teach people, you know, that they should not buy on the internet, but it doesn't work. I mean, in many ways. I mean, we do the attention, and it works for a while, but it has to come from maybe from the school, that the kids learn it, and then they teach the parents. In a way, it takes a long time. But it has. If somebody gets caught by selling falsified medicine, or if it's counterfeits, or doesn't matter the name, that something should be done with the person, arrested, the medicine seized, but then it has to be a legislation that will give this person imprisonment, and all his money should be, like, you know, taken from him. It should not be a lucrative business like it is now. Now it's like a fee or fine in the most countries. It's not only Africa, this is a problem. But I'm telling you, this is the only way. It's all about the money. You have to find a way of doing that. So collect the good sources, and then legislation, and then has to be it cannot be just like a smash on the fingers, has to be an effect. That's the way to, and then from above, they have to be there. They have to help the law enforcement, you know, to do things.
Yeah, so your call for disincentives in some ways to make it a not profitable crime ring really loud and clear. And I also think echo a lot of what I think MEDICRIME is trying to achieve. I'm going to open up the panel just with another question. So anyone who'd like to jump in on this, but what elements do you think make up an enabling environment for prevention? So what else can we do to enable the prevention of these products, either substandard or falsified?
Well, I can say one thing then, because I think that, for example, if you look at on the map of Africa, when it comes to seized products, you can also see that there are a lot of products, especially with raids, but many times, I would say most of the times, the majority, the private sector are not, they don't know about that their products have been seized. I work in the African network, and they share a lot of information, but in general, it's very, very difficult to get information out from the countries. And that is something that is a pity, because the private sector, all the pharmaceutical companies, they have a lot of information and they can help. And it's not illegal. I will say this 10 times. It's not illegal to work with the private sector. It's not illegal to get information or to give. So short.
Yeah, and just looking at certain regions, if we look at Burkina Faso, they're up to 80% of medical products are believed to be smuggled in by criminals. Why is that area such a hot spot for pharmaceutical trafficking? Cecilia, if you might just add on to that quickly before I move on to Adesanya.
Okay. I cannot say, well, I can, I don't know exactly about the numbers of Burkina Faso, but what I usually, it's the legislation, but also that the borders can be difficult to protect in many ways, big country, a lot of people, a lot of borders, and the people that are guarding the borders maybe don't know exactly what to look for. I mean, we can see that all over, like in Europe, it's hard for the customs there that they maybe have more experience, but it's hard, it's about, they don't enough people that are not enough educated for this purpose. That's what I would say.
So specific training. Okay, great. Over to Adesanya then, and then Oscar to add on.
Yeah, Cecilia actually also talked, nip it on the board. If you compare the cases of SF on the continent of Africa to other continents, let me use Australia as an example. Australia is surrounded with ocean, and it will be difficult for anybody to bring in SF, even though it's still there. But the way it affects us here in Africa is different. Why? We all share borders with ourselves, and these borders are very, very porous. I speak for my country. We have so large a number of unmanned borders, porous borders, and these things comes in, even though we know you can only bring in your products via some specific ports into the country. But this SF product comes in majorly from the unmanned porous borders. And until we begin to make look in this direction on how to man these borders, secure the borders, and of course, increase the level of education and awareness, even within the border towns, the occupants or the people living in this border town, to know the significance of things that comes in and its effect on the public, on the economic of the nation. Maybe we'll begin to see some tractions in that direction. Thank you.
Thank you, Adesanya. And then we'll do Oscar, Michel, and Richard.
Yes, thank you very much. I will go in line with what has been already said by my predecessor as well as by Cecilia. In fact, in this concrete case of Burkina Faso, we need to stress the fact that the porous nature of the borders that leave criminal groups too vulnerable to infiltration of counterfeit falsified medical products. This is one element. However, I would not like to stigmatize Burkina Faso. I would just say that Africa is a recipient country, for counterfeit and falsified medicines. Following the report from UNODC from last year, more than 600 tons of different medical products were seized in West Africa during international operations. So the positive thing here is that at least law enforcement are doing their job. This is an important element. A second element is also limited data. Limited data is available for example, for seizures of COVID-19 related substandard and falsified medical products in Africa. If we compare, for example, with Europe, with USA, and with Asia. And why this issue? Because of inadequate systems. This has provided an additional opening for organized crime to capitalize and exploit systems weaknesses in African countries, and in particular with minimal risk. This is what I would like to say.
Thank you, Oscar. Michel.
Thank you very much. I was listening very carefully, and I found this input very rich. But, the missing point in this whole debate is, from my point of view, is that Africa is changing. We need to understand that we have a new social demand from young people. People want to have access to safer drugs. People don't want to be just a passive recipient. Young people are demanding change. And they're demanding change, not just from people who are smuggling and coming with, but from their institutions. That's why I was talking about also corruption. Don't think that corruption doesn't exist. It will be very a bad approach from my point of view to just see mechanically and think that, okay, things will be addressed because we will do that, we'll do that. No, I don't think corruption is a serious problem. We need to fight that. Two, I want to also, something which was missing a little bit, and I think all of them mentioned it, is education. All others is very important. Richard also mentioned affordability is key for me to understand that, and unless we put the poorest segment of our society at the center of this approach, against it will not work. It will become the same thing when you have almost, like I said, 40% of health expenditure coming from out of pockets. The poorest people, where they will go? They will go on the market for cheaper. So it's important to really think about how they become also actors. When you have almost more than 70% living with less than $1, they are not anymore a passive beneficiaries of your program, of your laws. They are actors for change. So I heard Professor talking about that one moment. I think it's very important. Finally, Oksana, one point which is central to all of that is regulatory, is harmonization, is making sure that we have at least this body. I remember just myself being minister those days, having AstraZeneca vaccine and being arrested at the border of a big country by saying that we don't recognize this AstraZeneca vaccine because this AstraZeneca was produced in India. We recognize only Oxford one. So I think if we don't have our own, it is issues of sovereignty and it's issues of making sure that our dignity and our economic issues will be addressed. Particularly, and is missing in this debate, the last change is that African Continental Free Trade Area will be key. We will be moving soon from 1.3 billion. It's not anymore Lesotho, like one of my young brother was talking about it when I was mentioning porous borders. It's not just 1 million a year, 2 million a year. We will have 1.3 billion integrated market with possibility to move from Abidjan to Nigeria, to Bamako, to Burkina Faso. So I think this African Continental Free Trade Areas is very important to include in whatever we'll be doing in the future for fight the fakes. I think it's changing completely the nature of the way we'll do business, completely. So intermediaries and others, it will change completely the nature. So I will stop there. But thank you very much I was listening. It was very rich for me. I learned a lot. I hope I will continue to be in contact with all of you and helping me to make this regulatory system a reality in our continent. Thank you very much.
Thank you, Michel. That we're delighted that you were able to join us today, and we're very we will work together to fight the fakes. That I know for sure. Richard,
and
over to you.
I am free ambassador. I was pushing that with the president of France those days, long time back when I was a UNICEF UNAIDS executive director and secretary. I was always taking this issue very seriously. I am free ambassador.
Great, and we need as many ambassadors.
I will help my big brother.
Fantastic. Sorry, Richard, Cyril, and then we do have a question from the audience that I would like to take before we move on to our youth closing remarks. So Richard, please take the stage.
Yes, I think one more missing piece is around the supply chain planning. You know, the risk of entering of fake product in the system come always when we have issue of planning. When stockouts are there, emergency procurement is really risky at all levels, country level, up to the facility level. I think we cannot talk about improving and fighting substandard without also improving the supply system. But also, I think there is an issue of strategic monitoring system in the countries. We found, as Oscar said, during COVID, in our network, we were able to detect many different batches of chloroquine because it was declared that it's really effective against COVID, azithromycin. So whenever there is emergency, I think it's time to open our eyes. Regulatory authorities should work hard to check in the market, because these criminals, people, they know what is missing. They know what is in high demand. So it's good to make strategic monitoring of our availability, but also what is missing in the market. I want also to say, I think there is a good move in Africa around reaching maturity of our regulatory authorities and labs. But what I see, we should not think when a country has reached a maturity level 5 or 4, it's enough. I think in country we have these criminals who are doing things right in the countries. So the in country monitoring system should be also very strong, because that's where they operate when they know it's not easy to cross border with these fake products. Thank you.
Yes, thank you, Richard, for that. And we do see that there is these growing initiatives with Lome initiative as being one of the UNTOC tool as well. There are other aspects that we can, from a legislation perspective, also strengthen the response. But Cyril, over to you before we take the audience question.
So, am I in now, Oksana? Yeah,
Yes.
I just want to quickly bring in this dimension. Looking at the cultural and the religious background of my country, I think we need to take enlightenment campaign, advocacy, and education to the churches and to the mosque. I want to quickly say on this part, today is Thursday. On Sunday, I'm a Catholic, I've worked with my parish priest and worked with some other physicians and other health team. We'll be talking to the populace about drugs and about other issues, including fake drugs. And I have been able to also procure some good, authentic drugs from pharmaceutical companies free of charge, that probably after service there'll be consultation and eventually dispensing, as the case will be. Now, having said that, we also need to speak the language of the people. You may be speaking in English, but those who are involved may not be able to communicate. So we need to understand the language and speak their language. Communicate with them at their level. At the end of the day, it becomes everybody's activity. We don't work in silos. And I want to quickly add that in terms of education and curriculum, we could have exchange of ideas with other people from various countries, creating an opportunity where people can, if we have somebody in Tanzania that can deliver a particular lecture much better than somebody in Nigeria, why not? And we can do that technologically. That's just my little contribution, added contribution.
It's a fantastic way of working together, and one of the more positive means, or perhaps one of the small silver linings coming out of COVID, is that now we are much more all digitally connected, so that we can share resources way.
Exactly.
And I hope that, if there are people who are in the audience who are also willing to share their experiences with us, then please do reach out, because there's so much to learn from each other as well. I do see that there are some hands raised in the audience. So I wonder if we are able to get first Hashim and then Sadiq to either type or ask their question.
Thank you, Oksana. My name is Hashim Ubale Yusuf. Can you hear me?
Yeah.
Yes. Yeah.
Yeah, thank you very much. Yeah, thank you. And for putting this great speakers. It was a good presentation. But permit me, before I speak, to greet my president of the Pharmaceutical Society of Nigeria, Professor Usifoh, and
Thank you very
my
much.
former colleague, Adesanya. I have a question. But before I have put the question, I have this small primer. When you talk about prevent, detect, there are key issues. You know, we started from somewhere. People here have alluded to the aspect of collaboration and cooperation. Yes, we need to collaborate and cooperate. And out of that, many things came out. For example, within the ECOWAS region, Nigeria spearheaded the need for bringing all national regulatory authorities together and to form what we call World Run, and we developed a work plan on how to deal with this. We did a scoping, we found why and what we need to do to really prevent. It is rooted in collaboration and cooperation. But did it work? No. There was no political support. The judiciary was not well informed. And even the legislature, many of them don't even understand what we were doing. It became very difficult for us. 2, the Cotonou Appeal, which led to the MEDICRIME. When we launched it, we were very hopeful. We worked very hard to see a number of member states come into it. But MEDICRIME ended up in Europe. And do you know why? When we had impact, there were apathy. Many people, due to improper definition of what then counterfeits were, thought that it is an issue of patent, it is an issue of WTO. And there was a serious divide. And that divide is still there. People in Europe think differently from people who are in Asia and here. And you remember the Rotterdam case. A supply going to Brazil was seen, due to wrong definition, as a counterfeit. And people didn't want to invest into that area again. Now, even for detection, the detection that we had initially, Yankee is there. We started very well to remove suspicion with mini labs. Then we brought in holograms. We brought in the NAFDAC number for identification and many others. You know, these people bypass this. The products that are counterfeited, you don't see them. They don't follow the normal channel. So you can have level 4 or level 5 maturity level, but you won't see the products. Unless you see them, you analyze them before you even identify them, and then now you go to action. What do we need to do? That is now my question to all the panelists. We must come back to the drawing board. We must begin to really reflect, because on one part, the substandard products, if you look at the definition, these are products that are out of specification, but they have gone through full GMP and they are approved, so they are available, but due to bad practices, improper storage, transportation, even improper application of standard operating procedures, they fail somewhere. If they were not deliberately, it was not a deliberate thing. On the other side, for the falsified product, these are criminal activities. The other point also I want to help bring forth, like Cecilia mentioned, you know, we run the Pangia 1, 2, 3, 4, 5, 6, 7 to 12. Then what happens after it? What did the Interpol do with it? Was it evaluated? Did we move forward? We don't understand. No, we need to come back. We need to work as one. Those in Europe, Americas, in Africa, and those who even manufacture them from Southeast Asia will all must come back to have a common understanding. We're thinking the member state mechanism in WHO will do this work. Since it was established, it has not been evaluated to date to know what effect or what outcome was there. Thank you very much for giving me this chance. Appreciate you.
Thank you, Hashim, and also that message around political will to implement at all levels is incredibly important. But I think Oscar would like to respond to some of your comments more specifically on informing and educating the judiciary, which, of course, I think there is a real opportunity here for us through the Fight the Fakes partnership and collaboration to act upon. So over to you, Oscar.
Yes, thank you very much. Yes, I would like to thank my predecessor when he raised a certain number of issues. However, I would like to precise one element that he mentioned in relation to the MEDICRIME Convention. It is true that the MEDICRIME Convention was drafted in Europe. It was drafted in Europe because it was physically drafted in Strasbourg, in France, in the Council of Europe. However, this does not mean that only European countries participated in the drafting. I repeat again, in the drafting of the MEDICRIME Convention, UNODC was present with all the countries belonging to UNODC. WHO was present with all the countries representing WHO, as well as the European Union and other international organizations which participate in the Council of Europe work, as well as other third countries like the United States, Canada, Mexico, Japan, and other, the Holy See as well. And the issue is that nowadays we have Ecuador that have joined the MEDICRIME Convention, we have Chile, we have Israel that have joined the MEDICRIME Convention. This is just to show that the place where the convention is drafted, this is not important. What is important is the content of the convention. I can repeat it again. I mean, every country has its sovereignty to decide whatever it wants. However, the reality outside there is that there is a problem, and the problem should be tackled, and nothing will happen if there is no international cooperation. One of the problems that I can highlight in Africa, if you allow me, is in fact this distinction. I mean, the challenge in Africa is the distinction between Anglophone and Francophone countries. You know, there is a division there which prevents in particular full cooperation, whereas criminals involved in the trafficking of falsified medical products in particular, they have a common language, which is profit. So let's leave beside, you know, whether the convention was drafted in Europe or in Asia or in Australia. This does not matter. The problem is that we need to work together, you know, otherwise we will continue. This is the first element. Second element, law enforcement as well as judicial authorities are key. Law enforcement are the best ambassadors. Why? Because they need to do the bad work. They need to create, you know, all the scenario, well, not create, in fact, find out the scenario, what happened here and there. And the problem is with judicial legal professionals. I mean, most of the people that are coming from the health perspective, they know what fake medicine is. However, for a judge and for a prosecutor, listen, I've been working more than 12 years in this topic. And when I arrived there, and they told me, listen, because the excipient, because fake, because, sorry, what are you talking about? I have no clue. We are used to work and to tackle, you know, criminal networks. But when we need to talk about quality, this is really difficult. So training for legal professionals as well as for law enforcement is key. We count, of course, with other international organizations and of course with partners like, for example, Fake the Fakes, and with other entities, even private. Mention what Cecilia Fant said, because they have the knowledge, they have the know-how, and at the end of the day, what we want is to tackle this problem. I just briefly, I mean, I just heard from one of the speakers here, in particular Professor Cyril Odianose Usifoh. Sorry for my bad Spanish pronunciation. You had the meeting next Monday. You will have a meeting next Monday with your Minister of Health. Listen, we are happy, the MEDICRIME Secretariat, to help you or to provide you whatever assistance you may have from the legal side. Why? Because nowadays we are helping Côte d'Ivoire, Ivory Coast, in domesticating the convention. And this is the important thing. The international convention are outside there. However, afterwards, every country needs to domesticate the convention into its national legislation. This is not an issue imposed from an international organization. No, the international treaty is there. However, afterwards, the country should accommodate the legislation into its national legislation, taking into account its own characteristics. We can help to provide you with this work. And this is what we're currently doing in Africa with Ivory Coast, Côte d'Ivoire, as well as with Guinea. If you would like us to help you, please just tell us. Thank you very much.
Thank you very much, Oscar. Now, due to the time pressures, we must proceed to the final element of our program today. And I'm very happy to introduce Noha Abdelaziz, who is the lead of New Giza University Fight the Fakes chapter. And she is also a pharmacist and teaching assistant there. She is going to present to us a call to action that represents our academic chapter and youth groups. Over to you, Noha. Oh, I think we need to unmute you.
I think I was muted. Hi. Thank you, Oksana. Thank you to our moderator, and thank you to our speakers today who have pinpointed the urgency of taking serious measures against substandard and fake medicines in Africa and globally. Our healthcare system is not just a set of rules and procedures. It is a force that shapes the lives of everyone. As we wrap up this webinar here today and soon Fight the Fakes Week, our work must continue. Right now, Africa is feeling the impact of substandard and fake medicines causing harm and economic damage. We, the youth, representing the New Giza University chapter, speak for countless voices in healthcare. We demand action against fake drugs spreading in the global supply chain, and they are hitting hard in Africa and the Middle East. The COVID-19 times showed us something crucial. When there are shortages of real drugs, the fake ones will flood the market. It messes with our economy and breaks our healthcare systems. People suffer. Trust in science drops, and lives are lost. It is not just a health issue. It hurts families and puts a big strain on our healthcare money. We cannot ignore how serious it is. Let us take a moment to highlight that allowing this global issue to grow is a direct obstacle to achieving our 2030 vision of universal health coverage. In response, we're issuing a call to action, or more like a set of actions. Tackling this danger is everyone's job, especially those in a position of authority. It is time to prioritize the actions that aim to prevent, detect, and respond to substandard and falsified medical products through innovative and rigorous actions. Here's what to do. In terms of pre-market measures, we need concrete global collaborations. Yes, there are efforts underway, but there are still gaps that demand our attention. We must push for a robust international legal framework or treaty that zeroes in on substandard medicines. This framework should be flexible enough to seamlessly integrate into every country's legislation. To make this happen, we need heightened international endeavors, fortifying the management of global supply chain. Collaboration between national medicine regulatory agencies and law enforcement entities is not just necessary, it is pivotal. Next, let's focus on regulatory and national laws. We must regulate and standardize the registration process to ensure that quality assurance is at the forefront. Elevating the capabilities of regulatory labs is our starting point. This involves improving the surveillance techniques, establishing a structured system that mandates transparent reporting of substandard medicines. And talking about the second set of actions would be the intermarket measures. We need to tighten things up within the supply chain and boost public awareness. Supply chain transparency is key. Addressing the weak links in the supply chain involves certifying suppliers, ensuring transparent sourcing, and implementing a track and trace system. This applies not only to hospitals, but also to community pharmacies as well. Secondly, creating an awareness and engaging the public is crucial. Patients need to be educated and empowered to both spot and report the counterfeit products, especially when it comes to medications sold online. Thirdly, let's talk about surveillance and reporting. We need simple, accessible methods for patients and consumers to report issues. This can involve using technology like artificial intelligence, smartphones, apps, even dedicated hotlines. The goal is to make it easy for people to report and trace any problems within the system. For the final set of actions, tackling community pressure and legal constraints, we need strong laws, better data tracking, and media involvement to tackle this issue. Legal consequences are critical within this fight. We need solid international and national laws to punish this criminal activity and these criminals. This includes a consistent legal framework and strict registration of trusted sources, vendors, and companies. We need a robust database for surveillance. This means recording detailed data about batches, raw material, and even incidents, because it strengthens the law enforcement and creates a traceable database to understand the impact of a single falsified medicine. Lastly, media engagement is key. We need proper media coverage to grab the public and political attention. This issue is escalating and life-threatening. We need everyone on board. Media has the ability to mobilize the public. It's taking a toll on our healthcare systems, and even climate action and change is bound to be an integral part of this problem. So let's act now to improve the accessibility, quality, and safety of medications by supporting global preventive initiatives. It's time to take a stand for our health. Thank you so much.
Thank you so much, Noha, for your call to action. I think it really summarizes the key points of what all of our panelists also touched upon, with the added point that to gain that political will, media is a powerful tool to do so. I'd also like to thank our African Pharmaceutical Distribution Association for the interpretation provided, and of course to all of our attendees for joining us today, for supporting Fight the Fakes, and our expert panel for their time, their expertise, and their continued efforts and work to fight the fakes. Noha's over in Egypt, so I think we've got some good representation across the continent today and internationally, including those in the audience. It is truly a global effort, and we look forward to working with all of you together in future. Again, please do sign our call to action in the chat, but also reach out if you would like to collaborate or do any other work with us in future. So as always, we will reconvene in the next Fight the Fakes week. Hope to see you there. And if not, in any follow our social media. We've got at Fight the Fakes on Twitter or X, as well as on LinkedIn and other social media platforms, Instagram as well. So please do follow and support if you can. And that is all for today, folks. Thank you again.
Thank you. Thank you, Oksana.